Assalamu alaikum. My name is Rafi Husseini and welcome to Giving is Living. Today we have with us Dr. Abdul Ghauri, who is the program manager of our health and nutrition department in Helping Hand for Relief and Development. Assalamu alaikum, Dr. Ghauri. How are you?
Wa alaikum assalam, Brother Rafi. I'm fine, alhamdulillah.
How's everything been so far?
Yeah, alhamdulillah. Everything is good and we're enjoying a good time over here.
It's good, alhamdulillah. So I wanted to know, Dr. Ghauri, and me and the audience want to know that how did you come about at a Helping Hand? You know, how did it start for you? And I know I've never asked this to you personally, but maybe you want to shed a light on your doctor, right? So you're a PhD. What is your background? Just a little bit, just shed some light on that, inshallah.
Actually, I belong to a very kind of a rural area in Pakistan. I belong to district Sangar, Sindh. I born there, and I had my college over there in my own village. Then I entered into medical education, and I did this master's. That's MBBS from Liaquat Medical College, Jamshoro. That's near Hyderabad, Sindh. And so that's why I am a doctor. I'm a medical doctor. That's why.
Okay.
Then I did my master's in public health, and I entered into the area of this is another broader area of health.
Sure.
So, and I'm working in the area of public health for the last around 30 years. Mainly, I engaged in health program management side, but I also worked for some international UN organizations as consultant. I conducted different surveys and research studies also. I had been engaged in training and teaching doctors, paramedics, and community workers in a lot of public health issues. My key area of focus remained HIV/AIDS and then tuberculosis, and also some of the other infectious diseases like hepatitis B and C. So these were my key areas of expertise. Mainly managing the grants, managing the health programs at the provincial level, then at the national level. And now, alhamdulillah, I'm here in Helping Hand and again looking after this area of healthcare and nutrition program. It's again related to the mainly a part of public health program management over there. And here I'm looking after this program, which we are implementing in 16 different countries globally.
Awesome. That's mashallah. I mean, knowing that your background is already in medical side, and now you're leading a healthcare nutrition program, so like it's kind of like you had to come into this role, and eventually, like because you can also talk a little bit about like how when you started with Helping Hand, I know you were in the region in the field work, and then now you're in the healthcare side. So how has that experience changed for you, being in the field versus now dealing the programs?
When I came to US in 2015 and later on we finally shifted in 2017 over here. So I got retirement from my previous job in Pakistan and came here with my family. And I started looking for some job over there. And I don't know how, somehow, I reached to the manager, to someone linked with Helping Hand, and they asked me my resume. And when I gave them, then one executive director, he called me and he asked me, "Are you really interested to work in our organization? You have a different background, so we need a person over there in the region to look after, to manage overall this regional activities over there. So are you really interested into that?" And I said that, look, I have a passion for working for the people. So I don't mind, and I have this expertise of managing the people and organizing these events and interacting with the people, presenting different programs and activities. So they engaged me initially for as a regional manager in Midwest region, and we worked there for 4 years. And after that, I think somehow they realized that why not to utilize the medical side of mine. So they asked me if I'm interested to take up this portfolio. And before me, there was no public health, no healthcare professional over there to look after this healthcare portfolio. And it was a smaller portfolio as well. So the organization was growing, and they required some technical expertise over there to expand this portfolio and to see some of the technical areas as well. So Alhamdulillah, I feel myself as a best fit for this particular position, as this is my core expertise, which I'm utilizing right now.
Oh, that's awesome. That's really awesome. So what would you say, what is the healthcare nutrition program? You want to elaborate on that?
With this healthcare and nutrition program, actually, we are providing healthcare services, a number of healthcare services and projects we are implementing in different parts of the world, mainly focusing these destitute and marginalized population like refugees, poor and needy, women, elderly people, kids. Mainly we are focusing around 2-3 things. First thing which we are doing, and I think this is quite old program which we are implementing from 2010, it's a prevention of blindness program. And a lot of people, it's more than half of the reasons, causes of the blindness are just because of the one thing, that's cataract. And it's very much preventable cause of blindness, which we can easily operate it out and replace this hazy lens with an artificial one. And it's not too much costly. So we are providing this service in around 12 countries right now. Alhamdulillah. It's one of our flagship project under the healthcare and nutrition program, you may call it. And up till now, from 2010, when it was started in Pakistan, then gradually they expanded it. And then in 2016, they rolled it out in other countries. They took it to African countries, and also to some other locations, in Nepal as well. Yeah. So, and after that, today, when I am seeing this, more than 16,000 cataract surgeries have been conducted so far, Alhamdulillah. And now we are entering into new arena of this going forward. We are expanding our operations, like in Pakistan. Hopefully this year we will be completing 4,000 surgeries just in one country, inshallah. And likewise, we are expanding these operations into other countries. This year we have included Sri Lanka, we have included Bangladesh, we have included Afghanistan, and Jordan as well. So with this expansion, I think we will be able to provide these services. Many of the refugee populations, like in Bangladesh, we have a plan to establish an eye care center. Even it's not just a little project, but it will be a long-term program, as we are foreseeing that with this intervention, a lot of the people in the coming years will be benefited, will be required this. So this center will be established. We also tried to have these interventions in some parts of the India and Kashmir, but still we are struggling if we could do that. So, and other than the prevention of blindness project, we have Mother and Child Healthcare Center. In 2010, when there was a huge flooding situation in Pakistan, so after that, a lot of health facilities were vanished. Simply. So we established a number of health facilities. We re-established or newly established over there. And over a period of time, we handed over to the community after, in a way to make them sustainable. One of the centers is still there. That's in Miawali district. You can link it with the district of Imran Khan. So Miawali district, in one of the village, we are having this MCH center running since then, Alhamdulillah, and it provides these services of antenatal, postnatal care, deliveries, and also we take care of the kids, and sometimes we also take these services out of the center, and we organize camps, general medical camps, to provide these services to other community members as well. We started a new intervention in last year. We piloted that. That was in integrated healthcare clinics. We piloted this intervention in Karachi first. So what we did, we have different programs, we have orphan support program, we have children with disabilities program, and both these programs also needed healthcare services. So what we tried to integrate these 2-3 programs and streamline their healthcare needs into one. So we established this one clinic in Karachi under the same in the same premises where children with disabilities program was going on. And this was a very successful pilot intervention. This year, we started rolling out this model into other cities as well. So 5 more integrated health clinics we have established so far in Pakistan. Few more will be established in the coming year, inshallah. And the same model will be rolled out in other countries. Like we have expanded our children with disabilities program in other countries. So we are taking this program side by side with the healthcare and nutrition program. And with this program, we are not just taking care of the needs of the children who are directly registered in our program, but we are taking care of their family members as well, their mothers, their sisters, their elders, and other community members as well. So this is a very, very kind of a successful model. Then we have a fleet of ambulances. So these ambulances provide services to the needy patients from the home to the health facility or from the health facility to the home. Last year, what we did, not the last year, but I think in in the beginning of 2020, we equipped the ambulances of Rescue 11 service. This is the government service in Punjab province of Pakistan. So we equipped them with portable ventilators. In the COVID time, it was a very kind of essential equipment required for the patients to save their lives. So we provided them 10 ambulizers were provided, then their ambulances were equipped with that. Yesterday, I was receiving this information from this ambulizer guy, and he informed me that, alhamdulillah, with this intervention, we could save hundreds of lives while transporting patients from one point to the second point.
Alhamdulillah. As you can see, like the health and nutrition program is a very, very large, very broad. It's a program which has multiple smaller projects in it. Now, and you just mentioned right now that with the pandemic, we had to give them ventilators and the ambulizers. How has that changed in terms of working with the beneficiaries? And even how is HelpingHand help the staff on ground in allowing them to combat the pandemic?
This pandemic was a very great challenge, not only for the medical community, for the overall humanity, if you assess this. So from our side, we tried our best to provide them the safe and a safe environment to perform their professional duties of taking care of the patients. So firstly, we took care of our own staff. We provided them this protective equipment like masks and sanitizers. And we also provided this protective equipment, personal protective equipment, you may call PPE, to many of the hospitals and many of the critical care providers. This protective dressings and sanitizers. Also, we provided this PPE not only to the medical professionals and the doctors and the nurses in the hospitals, but to the community as well. And the masajid were our focus. And our partner organizations, they took part into this campaign. And I think hundreds of thousands of the people were provided this protective equipment through HelpingHand, and they benefited out of this intervention. The challenge was so great, and this changed altogether. This changed the approach of the medical professionals and the care providers and all this stuff. So in a way, it was a beneficial kind of a thing as well. We learned a lot, and we came out of this challenge successfully. Alhamdulillah.
Alhamdulillah, that's really awesome and heartwarming to know that we were on the ground when people needed us. Alhamdulillah. Now, I wanted to ask you, Dr. Ghauri, it's a healthcare and nutrition program, correct? Yeah. What plays more of a role? Is it healthcare or is it nutrition? And could you describe you just described what the healthcare aspect is.
Yeah, exactly.
Could you also describe what the nutrition aspect is? Like, what does the nutrition aspect of the program cover for the beneficiaries?
Yeah, it's quite interesting. Initially, actually, we did not realize, and it was just an healthcare intervention, healthcare program was there. But later on, when this orphan support program and children with disabilities program were attached, so we realized that most of the time, these two kind of population groups actually, they suffer a lot from nutrition point of view. Many of the children of both of these programs, they suffer from malnutrition due to multiple reasons. If a kid in the family is disabled, so many a times we saw that the family just ignored them. They draw less attention in all aspects of their life, including their nutritional requirement as well. And many a times they also suffer from different diseases. They also lead to some malnutrition and some kind of loss of appetite and all this stuff. So this nutritional part, we started keeping in mind the key requirements of our children with disabilities and the OSP, the Orphan Support Program children's. Later on, we extended it up to their families, as many of the times their mothers, mainly the mothers, they are also suffering from the same. Especially if I would talk about the widows in a family who is to take care of multiple children in the family, and there is less resources available. So many of the times, this burden of less resources actually has to be on the shoulders of the mother.
Yeah, certainly.
So that's why we have extended this arm of nutrition support, and Alhamdulillah, with this addition of nutritional support program, we were able to improve the health of our beneficiary, mainly this disabled children and the orphan children.
And when you talk about nutrition, it's meaning like foods that they can cook, right? It's not the package like those those the pre-packed like liquids or some stuff like that. It's actually foods that they can cook.
Yeah. When we say nutrition, our main focus is this key nutritional elements like proteins, like vitamins, like minerals. So many times these micronutrients and these protein kind of a thing, this leads to lot of health impact. So, what we are doing, we have engaged the dietitians in our program.
Okay.
So with the help of these dietitians, they teach them and they prescribe some very handy, very kind of a cheap and very easily available items from their, which they can prepare at their home. And they can overcome this challenge of malnutrition in particular areas.
That's great to know, alhamdulillah. I mean, it's more like we're giving them the essential nutrients rather than like trying to just provide a basic meal for them. It's important for them to be able to lead a healthy diet and a healthy nutrition program rather than for them to get food like bread and something just to survive. So that's really good to know, alhamdulillah.
Yeah.
Now, what are some of the challenges, Dr. Ghauri, you would say, like, especially with the pandemic and everything, what are some challenges that you face in terms of providing the proper healthcare and nutrition in these areas for our beneficiaries?
The challenges mainly are the resources, basically. We are a charity organization and we cannot provide each and everything. we have to draw our boundaries. We have very limited kind of resources. So what we do, we try our best to provide whatever we have, and the challenge is a multiple side challenge. It's a economical challenge, the financial affordability of the people. Most of the time, they cannot afford the medicine, they cannot afford the good nutrition, they cannot afford to go to some of the secondary and tertiary care facilities where they need some critical care which are required over there. Sometimes they have some comorbidities. Comorbidities means they have multiple diseases, not only one disease. So if we are taking care of one problem, there must be some facility, some care provider to take care of some other illnesses as well. Like if someone is suffering from diabetes, and also he is simultaneously developing the cataract, so we can take care of cataract, but we cannot. We have our own limitation for the diabetes, so we have to identify some health facility or some care provider or some other organization who can take care of diabetes as well. Or we have to rely on patients' own resources to take care of their diabetes. Or it's just one example I'm quoting. There are multiple challenges. One, the social challenge which we encounter many at times is that the community is not aware of many of the things. Lack of education, illiteracy, social taboos, stigmas, and so many things. And also this many times this rural population especially, they have to travel long distances, and the travel facility and the transportation facility is not easily available over there. Or many a times they don't have the resources. They cannot afford the cost of transportation. So they suffer a lot. These refugee populations, many a times, like we saw in Bangladesh, these refugees are in a overcrowded camps, you may call them. In one facility, it's around 1 million population living there. And the health facilities provided over there through different means and sources, it's totally not sufficient at all. And not each and every kind of facility can be provided into these camps. So they have to go out of the camp, and for going out of the camp, they have to have some permission, some permits, some limitations, and so lot of challenges. You name the challenge and challenges there. So many challenges are there.
I understand, and because us being a relief organization, I think this is something we have to expect, right?
Yeah.
That's why we are here, to overcome the challenges and to help the people in need. So it's very important to understand what the challenges are and how we as an organization, because in the back end, people always see the work that we do.
Yeah.
So they think it's all going smooth and well, we just give the money and it's just all flowing.
Yeah.
They don't understand the challenges that we have to face when we are overcoming these obstacles and trying to get to the beneficiaries. So that's a really wonderful thing. Now, Ghauri, since you took charge of this program, it's been a couple of years, I would say, right?
Yeah.
Where do you see this program growing in the next 3 to 5 years? What is your vision for this program?
Oh, thank you very much for asking this particular question. And I'm very much inspired and motivated.
And by the way, before I let you continue, I want the audience to know that in Helping Hand, the programs are pretty much run by one person for each program, and they have a team that they work with in overseas. So you don't even have a team, you're doing it on your own for the most part. You're the vision and the strategy behind it now moving forward.
Yeah, actually, the work, I think our role here is we are actually building the bridge in a sense that we are bridging the gap between the fundraising team and the implementing team. So we are connected at both sides. At the fundraising side, we provide them whatever the required material they need for marketing and the information to the donor, reporting back to the donors, supporting them, providing them some technical information over there, statistics, data, and the future plans and the strategic directions where we are going. At the implementing side, into the field, we provide them we provide them the technical guidance, the technical supervision, and also some policy guidelines of the organizations. And we channelize these resources to the implementation, converting into the actual activities or the services for the beneficiaries. So this position, the program manager position, is a kind of to keep a balance between resource generation and the and utilization of these resources into the field. And again, it's a two-way. One way is to provide these resources. The other way is to provide provide them feedback to the donor and the fundraising team what we did out of their provided resources.
Sure.
So in this way, we build this bridge. Going forward, as you know, as I already explained, that this is my area of expertise, and so I love to work in this particular area, and I opted for that voluntarily as well. And I think that keeping in within our limitation of being charity organization, but even then, I think we can go above and beyond whatever we are today by having this first. I will be more, I think, focused towards this cataract surgery project.
Sure.
That's the prevention of blindness project. I see a lot of potential into that. What I'm seeing is that we would be having, inshallah, in near future, we will be having some infrastructure developed on site where we will be able to send our volunteer doctors from US and other parts of the countries to serve, to go there on site and provide them their expertise free of cost. So in less resources, we will be able to serve more number of people. So this is one of the key factors which I am looking for as a moving forward, as a way forward, that we will be having our own infrastructure, inshallah, on ground someday, especially as we are trying the piloting this in this year in Bangladesh. So we'll be replicating the same in some of the African countries and also some other countries as well. Beyond that, this integrated healthcare model, which we piloted in Pakistan last year and we are rolling out this year, inshallah, this model will also be carried out. And we will be implementing this model into other countries, inshallah, as well. So by the end of 2025, I'm pretty hopeful that we will be having quite good infrastructure in place and a smooth, another add-on of a smooth project implementation for having volunteer doctors, the concept of volunteer doctors. So we will be bringing in this this concept into our programs. One more area which I would like to add, and I think from this year we will start working on that, is the mental health area. You know, the population which we are taking care of, there are they pass through with lot of trauma and lot of abuse and so many other things. They are passing through this situation. So many of these beneficiaries, many of these people, actually, they pass through very kind of a psychological setback. Many of them suffer psychiatric problems. And so we need to take care of this part as well. So inshallah, we will be adding on soon. We will be adding on this mental health. We have already started some working over there, and we will be rolling out by the end of this year. Hopefully, we will start some component of this program in Bangladesh. We are starting from Bangladesh, and also in Jordan for Syrian Palestinian refugees, inshallah.
Inshallah. These are some big goals, mashallah. And I mean, I think Helping Hand, with the growing organization that it is, it has the capacity to do this, and especially that idea of volunteer doctors. I think it helps when you have because we do have doctors back home in India, Pakistan who are qualified, but due to the lack of limitations in the country and everything, people from the US and the UK or all around the world sometimes have access to more research and more training. So that's why taking them, being able to go and help out in these countries is definitely going to be a helpful and a good direction for Helping Hand, inshallah. Now, before we wrap up, Dr. Ghauri, I wanted to get your some personal thing about you in terms of when it comes to doing this work that you're doing. You said you're already passionate about helping people. Before you came to Helping Hand, you're in the field of medicine. Who's one role model when it comes to humanity that you look up to in like a general aspect? Of course, we as Muslims, we have the Prophet Muhammad Sallallahu Alaihi Wasallam. That is the foundation. There's no question about that. But is there someone in your life or someone that you look up to that inspires you to do better every single day?
I think after our Prophet Muhammad Sallallahu Alaihi Wasallam, he is the one exemplary role model for all of us. And other than that, my mother is actually.
Thank you so much, Dr. Ghauri, for taking your time being here, for sharing this information with us. If you have a message for the audience, your supporters and donors, and how can they support this specific program? If you want to let them know the link and everything that they need to know for this program.
No, I really appreciate and thank you very much for giving me this opportunity. And just one thing I would like to share is with our audience is that look, we are taking care of your amana, basically. Whatever you are giving us, we are trying our best to utilize in the best possible means for the best possible causes. So whatever single penny we get from you, we try to benefit it maximum to provide the maximum benefit to our beneficiaries. And your donations is changing the lives of the people. It's not one, it's not two, it's millions of the people. So with your support, we can do wonders. We have on our website, we have the healthcare and healthcare page. That's www.hhrd.org/healthcare. So it's simple, easy.
Yeah, and they'll see the link when they're on the video.
Yeah.
So Jazakallah khair, Dr. Ghauri, again, thank you so much for being on this podcast. Thank you for giving us this information. As I always mentioned, when it comes to being good, when it comes to giving, when it comes to any act of kindness, we have to be first. From the example of Abu Bakr Siddiq radiallahu anhu, that he didn't have any competition when it came to doing good and being the first one in doing good. So if we are never in the position of receiving, which I pray and hope that none of us is ever in that position, we need to always be in the position of giving. That is inevitable. There's no excuse for it. Whether it's $1, $5, $1,000, go visit hhrd.org, support our projects. Thank you for tuning in. Jazakallah khair, and we'll see you next time.